Thank you for following me. I'm specialized in general surgery, in reconstructive plastic surgery, and aesthetic surgery. But I also have another specialty that is minimal invasive procedure and laser technology. Since 1994, I perform minimal invasive procedures and I use laser technology for full face rejuvenation and other procedures. The difference between my technique and resective blepharoplasty, that is the blepharoplasty that is performed since 80 years ago, and my conservative blepharoplasty. My technique consists in periorbital rejuvenation that, for me, and that is my personal point of view, is a new alternative to a resective surgery. Then, what are the differences between my personal technique and the resective technique? My technique consists in not removing skin, do not leave a scar, rejuvenation the skin with laser, and raise the eyebrow. Like we can see here, the eyebrow is very low, have a ptosis of the eyebrow, and here is the reposition of the eyebrow, and perform upper and lower eyelid rejuvenation without skin resection, and the tightening of the skin upper lower eyelid malar area with laser technology. Here is in the way the laser. This is the stab incision that I perform in the upper eyelid that don't leave a scar, and also provide an arrested and youthful expression, raising the eyebrow. Like I said in another chapter, the main factor of elderness is the ptosis of the eyebrow, mainly the tail of the eyebrow. If we resect the skin here, we lowering more the tail of the eyebrow, and we increase the aging process. Here is in the way that I raise the eyebrow through an endoscopic brow lift and tightening and improve the skin with laser. My technique provides a rested and youthful expression, raising the eyebrow and tightening the skin with laser technology. My new paradigm is tissue rejuvenation instead of tissue resection. I think we must treat patient skin in the same way that we like them to treat us. The difference between the resective blepharoplasty and laser conservative proposed by me is this. Resective blepharoplasty consists in resection of the upper eyelid and the muscular in this way, and this is the tissue and the muscle of the upper eyelid, and also resect the eyebrow skin. The conservative technique removes the upper eyelid fat pads in this way after remove the skin and the muscle, and this is in the way that give stitches here. My personal technique consists in perform a stab incision here, remove the upper eyelid fat pads through this small incision. We must have an ability to perform this, and here we can see the upper eyelid fat pads like we can remove through this small incision. This is the way that I tighten the upper eyelid. I put the eyelid protection like this. This is the tightening of the lower eyelid. As you can see in this video, I also tighten the malar area. And after doing that, I perform a full face rejuvenation with laser technology. We must understand the aging process is not only the lower eyelid, the upper eyelid, the ptosis of the eyebrow. Our skin, the aging process of our skin is in the rest of the face, and we must take this opportunity to rejuvenate the full skin. For the patient, it's better in one procedure not only to rejuvenate the upper eyelid, the lower eyelid, the malar area, also the nose skin, the lips skin. Everything must to be improved with laser technology. For the patient, it's much better to improve the full face when is performed an upper and lower eyelid blepharoplasty. This is the stitches of the upper eyelid blepharoplasty, and here we can see like I rejuvenate the upper and lower eyelid skin and no stitches here. This is 7 days after the procedure, and we can see how the small incision in the upper eyelid is imperceptible. The lower eyelid fat pads are removed through a transconjunctival incision, but I have another chapter to talk about lower eyelid and malar area rejuvenation. Here I'm only going to talk about upper eyelid and eyebrow rejuvenation, because there is a combination in this area with ptosis of the eyebrow and the skin. Here we can see like an upper eyelid conventional blepharoplasty lower the eyebrow and give this sad and tired expression, and here you can see how I raise the eyebrow and left a natural, fresh and rested expression. Blepharoplasty, like I said before, is an opportunity to rejuvenate the rest of the facial tissue, and for the patient is very pleasant in one procedure rejuvenate the full skin. I perform this procedure with local anesthesia and sedation, and the procedure don't last more than 2 hours. Blepharoplasty, I said, is an opportunity to perform endobrow lifts, face lift, liposuction of the neck, and full face laser rejuvenation. This is a patient treated in 1995. 1999, I performed this procedure since 1994. I have a long experience doing this kind of procedure. Here we can see the nice expression of the gaze, how I raise the eyebrow and produce an upper and mid face rejuvenation without skin resection, without any scar. This is a patient operated many years ago. I performed endobrow lift and full face laser rejuvenation. Here we can see the main factor of the aging process is the lowering of the eyebrow, mainly here the tail, and here we can see I raise the eyebrow and produce a laser rejuvenation. At this patient I perform a blepharoplasty, an endobrow. Here is the brow, here is the brow, the tail of the brow, and also I perform a face lick, neck lift, and a laser fat removal in the neck. This is the patient, and you can see no stitches, no scar. I put this patient because it's a bald patient, and you can see here that the patient have no scar. The difference is also from my technique. Another technique, I don't perform a long scar and resection of the skin in the frontal area. And here is the patient have a full rejuvenation, combining different procedures and different technique. Here you can see the expression of the patient, and also you can see I don't remove skin and I do not leave a scar. And this is also a patient. You can see the look of this patient, the pre-op, and here is the patient after procedure, endobrow lift, face and neck lift, blepharoplasty without scar, and laser rejuvenation. Here is the patient in another view. Blepharoplasty without skin resection and patient evolution. Let's see how the patient who underwent conservative blepharoplasty laser technique evolved. This is very important for the patient to know how they are going to evolve. I have with the laser edema the first 48 and 72 hours, because the laser produces a contraction of the skin, rejuvenation of the collagen, and all the patients have scabs that fall within 7 to 10 days. Some patients with the dark skin have transient hyperpigmentation that go along, and we can remove with some creams and also laser for hyperpigmentation that also in my clinic have. Here we can see the patient 7-day post. We can see no edema at 7 days because the edema lasts only 40 hours, just lasts from 2 to 3 or 4 days. And here we can see no scar, no stitches, 7-day post. At this patient I perform endobrow and my personal blepharoplasty without skin resection. You can see no scars and natural look. Many patients or medical doctors said that this result is not long-lasting result. This is wrong. The laser acts in the tissue during 6 months and lasts many years. Just resection is don't last the result, but when we tighten the skin, we rejuvenate the collagen, I can have long-lasting result. This is a patient with full face rejuvenation, endobrow, face and neck, blepharoplasty, and full face laser rejuvenation. This is 50-day post. You can see the difference between the pre and post. also improve the lips, the neck, the jawline. And this is the patient 6 years post. This is unbelievable, the result. This is the patient that have a ptosis of the eyebrow. Like I said previously, the ptosis of the eyebrow is most important than the flaccidity of the skin, and for this reason it's very important in this kind of procedure to produce a reposition of the eyebrow. We can see here in this line the ptosis of the eyebrow, and here we can see the position after 6 years, and also you can see how the tightening of the skin lasts many years. 6 years post, natural, youthful, and rested expression. Thanks for following me. Please wait for the next chapter. My next chapter will be requirement to perform my personal technique. I wait for you for the next chapter.